My name is Alfred Hurley, and I'm an interventional cardiologist at Nanticoke Memorial Hospital. Unfortunately, it wasn't all too long ago that in peripheral artery disease, when a patient came to the hospital with a leg that looked critical, the thought was amputate first and address everything else later. The good news is that across the country this has been steadily changing. Rates of amputation have been falling, and it's largely due to programs like SAVE that emphasize rapid response to improve blood flow to the legs and encourage limb salvage. So the major question is, why should we care about peripheral vascular disease? And my answer is that in PAD, or peripheral arterial disease, it's literally an epidemic with life-altering implications. Approximately 20 million Americans have peripheral vascular disease, and somewhere between 1 to 2.5 million people have critical limb ischemia, where they're at risk of losing a leg or limb from progressive wounds, ulcerations, and gangrenous changes. When it comes down to it, recognition is key, and that is both from the standpoint of the provider as well as from patients. There are two situations that I think are worth mentioning. I'll start with what we refer to as critical limb ischemia. This is where there's so much plaque and blockage in the arteries of the leg that it's impacting blood flow and oxygenation to both the muscles and soft tissue of the legs. These patients typically suffer from wounds and ulcerations that aren't healing well and have chronic pain in the legs even when walking short distances. It's important that in these cases you talk to a physician, whether it's your primary care doctor, endocrinologist, podiatrist, wound care specialist, or even your cardiologist, so it can be evaluated quickly. Delay in these circumstances is probably the most dangerous situation. The second group of patients are those with peripheral artery disease or plaque buildup in the legs that may or may not have significant symptoms of pain or wounds. Just the presence of plaque increases the risk of not only problems in the legs, but there's a strong association with major cardiovascular events like heart attack and death, with rates at 1 year of up to 20%. I think the most risky groups are those people who may have disease in the arteries and may actually have symptoms, but those symptoms are masked and attributed to other things like chronic back problems, bad knees, or arthritis. These go unrecognized for extended periods of time and never get the appropriate treatments and medications to prevent problems down the road. To sum it up, be sure to follow with a physician regularly so that you can have the appropriate screenings if you are at high risk for developing peripheral arterial disease. Also, if you have any suspicion because of pain in the legs, wounds, discolored toes, lack of strength in the legs or feet, don't delay in seeing a physician. To learn more, visit nanticoke.org/save or call us at 302-628-6222.